My name is Dr. Ali, and today's episode is about ADHD. Today, you will know everything you need to know about ADHD. As a parent, you will know how does this affect your child at school, friends, in extracurricular activities. How to parent these kids. How do we treat ADHD? Do meds work? What are the side effects of these medications? So let's start. What is ADHD? ADHD stands for Attention Deficit Hyperactivity Disorder. It is a condition that makes it unusually difficult for children to concentrate, sit still, control their compulsive behavior, or follow directions. I know what you're gonna say. Most kids at this time are like this. They are disruptive and oblivious to what parents and teachers said. That is very true. But even when you multiply these kids' behavior by 10, that's when you get an ADHD kid. Usually, their symptoms are so severe that it even becomes unusual when you compare them to children at the same developmental age. How do I know that if the child has the hyperactive impulsive type? You can spot these kids 10 miles away. They are the kids that are fidgeting, squirming, they're all over the place, they're running, they're climbing, they are extremely impatient, always on the go. They are the kids that are talking, interrupting, blurting out answers. And then there is the inattentive type. These are the kids that are easily distractible by anything in the environment. They are the kids that when you're talking to them, they don't seem like they're listening. They're easily forgetful, always losing things. They avoid or dislike sustained effort activities, and they have trouble following directions. A child with ADHD will either have predominantly the hyperactive impulsive type or predominantly the inattentive type or a combination of both. Here's a common question that I get from parents. Can a kid with ADHD focus on some things and others not? And the answer is absolutely yes. Kids with ADHD can focus on activities that are immediately rewarding to them. An example of that is video games. They can focus on video games, it's immediately rewarding, but not much on activities that are not immediately rewarding to them, like schoolwork or chores. How do you know if your kid has ADHD or not? One important thing that I always like to tell the families is that the symptoms of ADHD can be due to other things like anxiety, depression, trauma. So you usually need a professional help to sort out if this is just ADHD or this could be secondary to other conditions. Your kid has to meet certain criteria to say, well, I think he fits more into the ADHD. Number one, usually the symptoms are severe, even when compared to other children at the same age. I have 2 daughters, and it's very difficult to be objective about my kids, so I usually ask my friends, even though I'm a pediatrician. And that's why I think if you see something that just doesn't sit right with you, it's always good to ask other people who take care of your kid, whether this is like grandparents, teachers, other community leaders, the coaches, anyone who takes care of the kid. Number 2, this has to be present for an extended period of time. If your child just is acting a little bit strange or like hyperactive or seems not to concentrate for like 3 months and then he is totally back to his normal self, this is not ADHD. Number 3, this is really important. It has to be present in multiple settings, which means that if your kid is behaving a certain way at home and he's completely fine at school, this is not ADHD. ADHD symptoms have to be consistent in all settings: school, home, practice, everywhere. Number 4, these symptoms have to be severe enough to affect the child's life, meaning that it affects the schoolwork, it affects his interaction with friends, Who really cares if your child is just a little bit hyperactive, running, always on the run, always on the go, but is doing great at school, is having friends, is having play dates? So it has to be severe enough to affect his life. ADHD doesn't only affect the kid's school life, but it also affects other aspects of the kid's life. It affects his friendship, family life, extracurricular activities. So friendship, they have trouble making and keeping friends. They are usually very interruptive. They are black labeled from play dates because you can count on them to behave. It also affects extracurricular activities because it's difficult for them to be in a team. It's difficult for them to focus or follow rules. And finally, family life. They are usually in conflict with parents and siblings. They don't follow instructions. It literally becomes a battleground when they have to transition from an activity that is pleasurable to them to do something that they don't like. From their perspective, you are asking them to do something that is very difficult for them. And so they try to avoid this behavior. How do they do this? By throwing tantrums, by arguing, by defiance, and it's literally a power struggle. If you have a certain concern, you talk to your pediatrician or the caregiver, and then they will give you a screening questionnaire to fill. They give you two forms, one to the parents and the other form will go to the teachers. The one that we commonly use in office is Vanderbilt. Once you have these questions filled, your pediatrician will score them and will let you know if this is most likely falls under ADHD, which type. Is it the hyperactive impulsive type, or is it the inattentive type, or it is the combined type? They will let you know if this could be secondary to other conditions, or if your child is likely to have other condition other than ADHD.